I'm Dr. David Thomas. I'm a practicing psychotherapist with the Whitford Thomas Group in Tampa, Florida, to discuss how to diagnose bipolar disease. We refer to bipolar disease as bipolar disorder. Many years ago, we referred to it as manic depression, which some people even today believe is a much better description of the mood disturbance. But how we diagnose this is to determine at some degree what are the symptoms, the behavioral symptoms of the disorder. If we look at the mania side, the symptoms of mania tend to be, mania being an elevated mood, tend to be kind of a expansive or exaggerated sense of self, oftentimes kind of a grandiose position. Oftentimes with mania, we tend to see a very heightened level of energy, a decreased need for sleep. Also with mania, you'll tend to see a lot of kind of high-risk acting out behaviors, be it drinking, indiscretions regarding sexual practices. On the depressed side, we diagnose the depression very much like we would in a unipolar depression. And with the depression being kind of a sense of hopelessness and helplessness, the individual tends to have difficulty sleeping. Oftentimes there's thoughts of suicides. Oftentimes with depression, we're looking at a fatigue, a loss of energy, a sense that things are not going to get better, a sense of doom, a sense that they can't do anything about that. And you really have both, depending upon how you diagnose this, whether it be a bipolar 1, which oftentimes has no depression piece, just the mania or hypomania piece, bipolar 2, which has at least one manic piece with various episodes of depression, and cyclomania or cyclothymia, which can be a combination of both, and then bipolar disorder, not otherwise specified. I hope this information has been helpful regarding the diagnosis of bipolar disease, bipolar disorder. From Tampa, Florida, I'm Dr. David Thomas.